In this video, we'll analyze the treatment for side effects of hormone therapy. This is a clinical case of a male patient aged 70. This patient had prostate cancer, and because of that he was doing hormone therapy. And he came to the clinic with the complaints of anxiety, insomnia, and hot flashes. This is a very complex case, so I did the full TCM diagnosis. I started with the tongue, and what I could find is it was very red. It had yellow coating, and it was very dry. When I analyzed the pulse, I could see it was very fast and, in general, very strong. Looking at specific sites, I could see it was very full, especially in the place for earth and for wood. It was also very full in the right kidney. And what can we conclude from this information? Well, the information on the tongue, we can see a lot of heat and dryness. This is very typical when you have heat in the Yang Ming. Particularly in the stomach. The Yang Ming in itself is very prone to problems relating to heat, and when you have heat in the stomach, you will start to develop dryness because the heat will consume the fluids. Also, looking at the pulse, we see a lot of signs of heat, and particularly you can see that we have an excess on the part of wood, probably liver, excess in liver. Also, we have something interesting, which is this fullness in the pulse for the right kidney, and this is to be expected if you think that the patient is undergoing hormone therapy. We can look at hormones as the yang part of the kidney, particularly as the menstruifier. If you think the menstruifier comes from the Ming Man, kidney yang, and will heat and allow for the other organs to do their functions, give them the movement. This is more or less the effect of what we now know are hormones that will make different systems work and stimulate them to work. Since the patient is receiving external hormones for his treatment, it is to be expected that we have an excess of the menstruifier. So an excess of the kidney yang, but if you think of menstruifier, you can also think about an excess in pericardium and the triple warmer. So what channels will we choose for our treatment? We saw that we have a clear problem regarding the Zhui Yin, being the liver, which we saw was in excess, and the pericardium because of the menstruifier. At the same time, we saw we have a problem with the Yang Ming, particularly with the stomach. But we can also think of the large intestine, which is a channel very prone to suffer from problems relating to heat, and also has a special relationship with liver, as the people who practice balanced method know. Other than this, I wanted to add something more to our treatment. I wanted to add the triple warmer because of its relationship with the menstruifier, and I also wanted to protect and strengthen the yin of the kidney. And why do I want to do that? Well, if we have an excess of kidney yang, One of the best ways to control its symptoms is to strengthen the yin, so the yin will control the yang. And how did I do that? Using the balance method. For this treatment, I chose to use, as we saw before, the pericardium, and the points I chose were pericardium 3 and pericardium 5. Pericardium 3 is a point that treats heat and is also the water point for the pericardium, so it will connect us to the water phase and therefore the kidney. Also, pericardium 5 is a point that is very good treating heat, particularly heat of the stomach, which is one of our main problems. On the other arm, I said I wanted to use large intestine and triple warmer. I started with large intestine 11, which is one of the best points to take heat out of the body, and I needled it but also bled this point, and I added lingu and dabai, which belong to the large intestine channel and are very useful in this situation as they will balance liver and treat the flow of qi. For the triple warmer, I used triple warmer 5, which is a great point to treat heat related problems also. Going now to the lower limbs, I said I wanted to treat the liver, and the points I chose were liver 3 and liver 8. Liver 3 is the earth point of the liver channel, so it will help us connect to the stomach and will also balance the whole liver. I also used liver 8, which is the water point, again doing the same thing that I did with pericardium 3. And I told you that I wanted to strengthen the kidney yin, and to do that I used a Master Tung Dauma called the 3 penetrating, which are points 8809, 8810 and 8811. These are the best points according to Master Tung Acupuncture to strengthen the yin of the kidney, plus they are on the spleen channel, so they will help us strengthen the earth and will also give us the second relationship we needed for the triple warmer to complete this balance. And to finish, I treated the stomach channel using stomach 36 and stomach 44. Stomach 36 is the earth point in the stomach channel, so it will doubly strengthen the earth because it's an earth point from an earth channel. And of course, stomach 44 is the water point and is also a great point to take heat out of the stomach channel. Besides these points, I also added Anmian because in my experience it is the best point to treat insomnia. When the patient first came to see me, he told me that he was suffering from insomnia every night, having problems falling asleep and also waking up several times during the night. He was also feeling anxious all the time, and the heat flashes came 4 or 5 times every day. Very intense heat flashes. After this first treatment, the patient told me, in the second appointment of course, that the heat flashes reduced to 1 or 2 a day, the insomnia was completely gone, and he felt much more relaxed. We kept this treatment once a week for the first sessions until the patient told me that the heat flashes were consistently 2-3 times a week at the most, and the insomnia and anxiety were completely gone. We kept the treatment until today, doing it once every 2 weeks, and this is a treatment that it will be very hard to stop as long as the patient is still doing the hormone therapy, because he will constantly be getting that stimulation from the hormones every time he goes in to do the treatment. So we will have to keep doing our treatment to balance that out and keep the undesirable side effects out of his life. If you like this video, don't forget to like and subscribe to the channel. Also, if you like to learn more about the balance method, don't forget to check out the course I have in the description. For now, the course is Portuguese only, but in the next few weeks I'll have an English version available for you to download.